The objective of this project is the development of an EEG-based BCI system that can decode the imagined hand movement kinematics from non-invasive EEG signals of stroke patients who suffer from upper limb movement disability. In the decoding algorithm, an event-related synchronization-desynchronization analysis was conducted to check whether the subject has performed the motor imagination task or not. Then the study investigated the cortical activity associated with the motor imagery of the affected hand in left and right directions using phase lock value features. Further, classification outcome used to generate control command to an external motorized arm support on which the patient's affected arm is placed. It provides active rehabilitation by moving the affected arm towards the intended direction. The data for the study was collected from NIMANS Bangalore based on a bug-killing GUI, and the experimental timeline of the developed GUI is shown here. Here the patient has to imagine the movement of his affected hand towards the bug position according to a visual cue. The training protocol has 2 sessions. Calibration session is intended to optimize the outcome, which can be employed in the feedback session. In the feedback session, the classifier model trained during the calibration session is used to predict the imagined hand movement direction in each trial of the motor imagery task. The video shows a patient undergoing motor imagery task during feedback session and moving his affected hand in the direction of motor imagery with the aid of motorized arm support. Here this motorized arm support is providing physical practice to the patient for neurorehabilitation. The classification accuracy obtained for this patient was 76% during the feedback session. The average classification accuracy obtained for all the 16 subjects was 74.44% in the calibration session and 68.63% in the feedback session.